Welcome back to Inside South Florida. You probably know AFib is bad, but do you know exactly what it is? Well, here's a heart-to-heart about that and the latest local advancements in open heart surgery. Dr. Beyer, good to see you, and you dressed up. I like it. You're looking good.
Yeah, I just came right off the streets in this, so yeah.
Right. Just wear it every day.
Yeah, I just kind of, get preferential treatment, parking, like that.
Sure, and you never know when a cardiovascular emergency might break out.
That's right.
So we're going to talk about, I guess, some exciting stuff, right? Like it's a good time to be in the field of heart surgery because these surgeries are getting a lot less invasive, right?
That's correct. That's correct.
For a number of conditions. The one that we always hear about on TV, we always hear the word AFib. Nobody really knows what AFib is. You know.
Yeah.
What is it?
That's a great question. Like you said, you hear about it all the time on at night when you're watching the news. You'll see medicine. We're treating AFib, but really what AFib is it's a arrhythmia or a rhythm disturbance of the heart. And what's going on is there's two upper chambers of the heart and two lower chambers of the heart. And the two lower chambers are called the ventricles, and the two upper chambers are the atria. And when you have atrial fibrillation, those two upper chambers are quivering. And when you have ventricular fibrillation, you die. I mean, you drop dead.
Wow.
So so ventricular fibrillation, very different rhythm, arrhythmia than atrial fibrillation. Atrial fibrillation, you don't just drop dead. You have shortness of breath. You can become dizzy. There's all types of things that go wrong when you have atrial fibrillation. It's because the top two chambers, instead of contracting and relaxing, they're just quivering. And because they quiver, the blood swirls in those chambers. And because it's swirling, it can cause clotting, and those clots can then go into the ventricle, out to the rest of the body, cause strokes and other issues. And so that's why we treat AFib so seriously, but it's not what we call a lethal arrhythmia.
Well, it sounds terrible.
It's not good.
It does not sound good.
Yeah, it's not good, especially if you have a stroke. Then you really have a problem.
All right, so we're going to talk about mitral valve and aortic valve as well, but regarding AFib, there's some great surgical advancements now, right?
That's correct. There's a lot of great surgical advancements. Your electrophysiologist is somebody that usually sees you when you have atrial fibrillation. I'm obviously a cardiac surgeon, and I work closely with electrophysiologists. There's one in town named Dr. Kenningsberg who I work particularly closely with, and he focuses on treating atrial fibrillation. And there's different spectrums of AFib. There's people that come in and they've had it once or twice, and they go in and out of it. They get treated with medicines. And there's people that have more what we call paroxysmal AFib, going more and more in and out of it. And then the people that have persistent or chronic persistent AFib, and they're pretty much permanently in AFib. And I, as a surgeon, treat the end stage version of AFib, whereas electrophysiologists tend to get involved earlier in the process if the patient gets to them in time. And so the ways we treat them typically are with what we call a maze procedure, and that was back in the old days, back in the 80s. There was a guy named Jimmy Cox from St. Louis, and he designed this procedure, and it looks kind of like a maze. When you cut and sew the atrium together, it looks like a maze. So he called it the maze, and a lot of people refer to it as a Cox maze because Jimmy Cox obviously designed it. And we learned a lot from that procedure. That was really the only way to treat AFib for a good long time. And now there's so many great advances, particularly in the last 10 years, treating AFib, that it's quite incredible. You can do all these ablations. Some people get treated through the vein. Sometimes you need to be treated through a little small incision, but the advancements are tremendous.
Yeah, and regarding aortic disease, mitral valve disease, same deal, right? The surgeries are getting much better.
Yeah, that's right. That's exactly right. I mean, it's basically the same kind of technological advancements that have taken place in AFib have taken place with the valves too. So you've got aortic valves. We now can treat them through percutaneous devices. And if you're not a candidate for that, we certainly can treat them through small incision surgery. And the same thing goes for the mitral valve. There are these new devices coming out. They're not quite as ready for prime time as maybe the aortic devices, but we also have great therapies for that. We do small incision surgery. In fact, I operated on a gentleman on Friday, and he can go home today. So it's he was in the hospital for the weekend, and then he's able to go home, and we treated his mitral valve thoroughly, completely. He doesn't have any more leaking, and and he's feeling up to going home today.
I love it. It's a good
Yeah.
thing you're wearing this outfit all the time.
That's right. That's why I was with him
never
not
know.
too long ago. So, yeah.
All right, people have probably a bunch of questions for you. How can they find you?
Well, you can find me a number of ways. There's a website with my name on it. Erik Beyer, ErikBeyer, and I work for Tenet Florida Physician Services, which is TFPS. If you go to the TFPS website and you look up my name, Erik Beyer, you can get a hold of me. So.
And you have your own YouTube page?
Yeah, I do. I have my own YouTube channel. It's Erik Beyer, and we have videos on it. Some are these one-off cases that I've done. Somebody been shot in the chest with an arrow. We videotaped us removing that, and people with pulmonary emboli. And then of course we do the valvular heart surgery videos on there, so people can see what they might be going through here shortly.
Well, listen, what you just did was give us a great reason to bring you back, because now next time you come back, we got to talk about the arrow in the chest.
That's
That
right.
sounds unbelievable.
I'd love that. I would love for you to look at
Wow.
that. It's crazy.
Good to see you.
Yeah, no problem. Thank
All
you
right,
so much for
got
having me. I really
Of course.
appreciate it.
Yeah.